Okay, so I'm here with Professor Ed Watkins today, and I'm really excited to see you at BABCP in Manchester this year. And there's obviously loads of great things to look forward to about the conference, but let's start with your science if we can.
Right.
So can you tell us a little bit about your keynote and then maybe some of the highlights from your workshop?
Yeah, so in terms of the keynote, it's really kind of following up on the journey that we've been on with all the work in treating worry and rumination. So the work we've been doing on developing rumination-focused CBT, obviously been doing that for 20 odd years now, but we're moving, I guess what we'll be talking about in the keynote is moving from the work that we've done in face-to-face treatment and then looking at how we've been developing it to disseminate further, to make it more scalable in terms of what we've initially done and the trials we've done on internet delivery, both initially with support, and then as we've been moving forwards to look at more prevention, we've been looking at how we can deliver it through apps and also in an unguided format. So that's going to be one of the themes, is how we've been taking forwards the intervention to try and make it more effective at reaching more people by reducing the level of therapeutic input, and whether it still has some of the benefits, and running a number of trials that are building on that and moving it into an app context. But we haven't kind of completely given up on the therapist being involved.
Yeah.
So the other strand is, how do we maximize the efficiency of that intervention as well as make it more scalable? So there's some questions there about what is it about the therapy that's really working. So I think that's the other big strand of what I've been doing research on over the last few years, is not just dissemination, but also what are the active mechanisms. So a few years ago, we published a trial that was trying to decompose how online CBT worked with therapy support. So as might be received commonly in IAPT, for example, or talking therapies now, and that was using a factorial design, and we're building on that with a big trial and grant that we're building on to see if we can understand what are the active ingredients within the rumination-focused CBT therapy, because there's a number of different moving parts, and it might be some of them do more work in general, or might work better for some people than others. And that's really one of the things we'll be talking through in the keynote.
Brilliant. Sounds fascinating, and really kind of thinking about that complexity, I guess, of both treatment development, but also the complexity of depression, and lots of different modalities in order to deliver the interventions for meeting the need of a range of people. So that sounds fascinating. Can you tell us a little bit about your workshop as well?
Yeah, so the workshop's going to be more, introduction and getting the kind of core principles of the rumination-focused CBT therapy. So we've been developing that and improving that over the last 20 years. And I think the workshop's also improved because we've been running a number of training programs now. So we've actually done quite a lot of work at starting to train people in the UK and people abroad, mainly in the US, in the therapy. So I think the training itself has evolved as we've been doing more training. So that means that the program, in terms of the workshop, will cover the kind of key principles of the therapy, so the targeting, worry and rumination as a habit, and what are the effective CBT elements, sort of behavioral activation, functional analysis elements to tackle that. And then the other part, which is about shifting the unhelpful thinking style that we often see in worry and rumination, and some of the practices that we do for that. So shifting out of a more abstract thinking style into a more concrete thinking style. But also the work we've been doing on absorption and compassion. So there'll be kind of introducing those principles, some experiential exercises on those principles, and we've also been developing quite a lot of video training, sort of short segments of video of role plays of people doing those. Of course, we won't be able to show all of that in a workshop, even in a day. You can't cover it all, but we'll have bits, hopefully enough of that to give people a real sense of how the therapy's been evolving and our most current thinking about how to make it work as best as possible. And that's really been developed through the fact that we've been running trials and training people in various places to deliver it now, including high intensity therapists in the NHS.
And I guess it's that real shift from focusing on the content to focusing on the process of what you do in therapy, which feels so important. That sounds absolutely fascinating. Thank you. Okay, and so then sort of broadening out a bit from the science, is there anything that you're particularly looking forward to about the conference in Manchester this year?
Well, I guess the first thing is it's a while since I've been to one of these conferences, partly I think because we've all been super busy and obviously COVID and all the rest of it. So it'd be great to actually get together and see some folks I haven't seen for a while. I mean, so it'll be the first big CBT conference I've been to in the UK and Europe for a while. I did do the World Congress last year, but it'd be great to catch up with lots of people and hear all the exciting new things that people are doing. And sometimes there are kind of key people on the program. You go, oh, yeah, that'd be really interesting to hear from them. But then there's all the sort of spontaneous talking to folks and hearing the new things that people are thinking about, which often is one of the best things about conferences. Is, you know, you're catching up over a coffee or a beer, and hearing what people are thinking about doing. So that'd be great. I mean, I'm really looking forward to seeing. I really like the stuff Jamie's been doing. I think that's really thoughtful, innovative work in practice. And the other person I've talked to before, and I really think she's doing great stuff, is Jessica Schleider's work on single session intervention. And when you think about what we do online, I think there's a lot of dialogue there, because sometimes people only might hang around for a small amount of an intervention. So it's working out what's the most useful bit to give people so they get the maximum benefit. So I think there's some really interesting stuff coming up.
It definitely feels like a really rich program, but you're right that there's also so much new thinking and innovation that comes from all the bits around the edges as well, which is lovely. Brilliant. Well, thank you so much for talking with us today, and we look forward to seeing you. Thank you. Look forward to seeing you soon.